The best time to plant a tree was 20 years ago. The second best time is now. This old proverb isn't just about gardening. It's about your health, especially when it comes to colon cancer awareness. Today, we're planting seeds of knowledge that could grow into life-saving action. We'll explore 9 symptoms that seniors often overlook, but should never ignore. It's time to nurture your health with the care it deserves. Before I continue, please consider liking this video and subscribing to our channel. We appreciate your support. Now, let's get into uncovering some of the warning signs of colon cancer. Did you know that colon cancer symptoms can hide in plain sight? It's true, and it's a challenge that many seniors face. Recognizing early warning signs isn't always easy, especially when they mimic everyday issues we've come to accept as part of getting older. Here's the thing. Those common symptoms you might brush off as nothing serious, they could be your body's way of waving a red flag. Take constipation or diarrhea, for instance. Many of us experience these from time to time and think nothing of it. But when these issues persist, they might be telling you something important. Why do seniors often miss these potential warning signs? Well, it's not uncommon to attribute changes in our bodies to the natural aging process, that occasional stomach ache or feeling of fatigue. It's easy to chalk it up to a busy day or a meal that didn't agree with you. But here's where it gets concerning. By dismissing these symptoms, we might be overlooking crucial early indicators of colon cancer. Let's talk numbers for a moment. Did you know that a significant percentage of older adults aren't aware of the potential implications of these symptoms? Many attribute them to non-threatening causes, which can lead to late-stage diagnoses. It's a sobering reality that highlights the importance of staying vigilant about our health. Consider this. A study showed that many older adults don't recognize the seriousness of their symptoms. Common complaints like fatigue and changes in bowel habits are often waved away as just another part of getting older. But what if they're not? Here's where it gets really important. Ignoring these symptoms can have serious consequences. By the time more obvious signs appear, the cancer might have progressed to a later stage, making treatment more challenging. That's why paying attention to your body is absolutely critical. Dr. David Richards, a gastroenterologist, puts it this way. Anytime symptoms persist for longer than 2 weeks, they are cause for concern. This is especially true if you're experiencing abdominal pain, bloody stools, or unintentional weight loss alongside other symptoms. This expert insight underscores the importance of not dismissing these changes as just a normal part of aging. So, what can you do? Start by tuning into your body. Notice changes, no matter how small they might seem. And if something doesn't feel right for more than a couple of weeks, it's time to have a chat with your doctor. Remember, early detection can make all the difference. Now, let's dive into the specific symptoms you need to watch out for. These are the red flags that could save your life if you catch them early. Are you ready to learn what they are? Red flag number 1, the bathroom dilemma. Imagine if your body had a built-in early warning system for colon cancer. Well, it turns out it might, and it's closer than you think. The next time you visit the bathroom, pay attention. What you see could reveal more about your health than you ever imagined. Let's talk about what's normal when it comes to bowel habits. Everyone's different, but generally, having a bowel movement anywhere from 3 times a day to 3 times a week is considered healthy. What's most important is consistency, your own personal routine. But here's where things get tricky. Sometimes, subtle changes in your bathroom habits can be your body's way of signaling that something's not quite right. These changes might seem insignificant at first, but they could be early signs of a more serious issue like colon cancer. What should you be looking out for? Pay attention to any persistent changes in your stool consistency. Are your stools suddenly looser or harder than usual? Has the frequency of your bowel movements increased or decreased significantly? Even changes in the appearance of your stool, like unusual colors or the presence of blood, shouldn't be ignored. You might also experience a sensation called tenesmus. This is when you feel like you need to have a bowel movement, even when your bowels are empty. It can cause discomfort and lead to excessive straining. If you're experiencing this regularly, it's definitely something to mention to your doctor. Now, you might be wondering why these bathroom changes are so closely linked to colon health. The answer lies in how colon cancer develops. As tumors grow in the colon, they can affect how your digestive system functions. Depending on the size and location of the tumor, it can alter your bowel habits in various ways. Here's the crucial part. Recognizing these symptoms early can make a world of difference. Colon cancer, when caught in its early stages, is often treatable and even curable. But if these warning signs are ignored, the cancer can progress, making treatment more challenging. So what's the takeaway here? Don't be embarrassed to talk about your bathroom habits, especially with your doctor. If you notice any persistent changes lasting more than 2 weeks, it's time to schedule a checkup. Remember, being proactive about your health could save your life. Now that we've covered the importance of monitoring your bowel habits, let's move on to another critical symptom that often goes unnoticed. Red flag number 2, the unexplained weight loss mystery. Have you noticed your clothes fitting looser lately, even though you haven't changed your diet or exercise routine? While many of us would celebrate shedding a few pounds, this effortless weight loss could be masking a hidden danger. Let's explore why unexplained weight loss in seniors isn't always a cause for celebration. It's no secret that many older adults struggle to maintain a healthy weight. So when the numbers on the scale start dropping without effort, it might seem like a blessing. You might think, finally, those extra pounds are melting away. But here's the catch. Unexplained weight loss can actually be a red flag for serious health issues, including colon cancer. Why would cancer cause weight loss? It's all about how the disease affects your body. When cancer develops, it can trigger changes in your metabolism. Your body suddenly needs more energy to fight the disease, creating a calorie deficit. This means you're burning more calories than you're taking in, even if you haven't changed your eating habits. But that's not all. Cancer can also mess with your appetite and how your body processes nutrients. You might find yourself feeling less hungry or experiencing nausea that makes eating unappealing. And even when you do eat, your body might not be absorbing nutrients as efficiently as it should. Now, let's talk numbers. Did you know that about 40% of people diagnosed with colon cancer report unexplained weight loss as one of their first symptoms? That's a significant portion of patients, and it highlights just how important it is to pay attention to changes in your weight. Consider the story of Kenneth, a patient who experienced significant weight loss without trying. At first, he thought nothing of it. But as the pounds continued to drop and other symptoms emerged, he finally sought medical help. This decision led to a colon cancer diagnosis, highlighting the importance of not ignoring unexplained weight changes. So, what's the takeaway here? If you notice you're losing weight without trying, especially if it's more than 5% of your body weight over 6 months, it's time to talk to your doctor. While it might not be cancer, it's always better to investigate and rule out serious causes. As we wrap up this discussion on unexplained weight loss, remember that your body has ways of communicating when something's not right. Next, we'll explore another often overlooked symptom that could be your body's way of waving a red flag. What do you think about the symptoms we've covered so far? I would love to know your thoughts, so please consider sharing them in the comments. Red flag number 3, the hidden danger of fatigue. Think you know everything about being tired? Think again. There's a type of fatigue that can't be cured by rest, and it might be your body's way of sounding an alarm. Discover why this sneaky symptom is often dismissed by seniors and learn the crucial time frame for when you should start worrying about your tiredness. We all feel tired sometimes, especially as we get older, but there's a big difference between normal tiredness and the kind of fatigue that could signal a serious health issue, like colon cancer. This isn't just feeling a bit sleepy after a busy day. We're talking about a deep, persistent exhaustion that doesn't go away even after a full night's sleep. So what makes cancer-related fatigue so different? Unlike normal tiredness, this type of exhaustion doesn't improve with rest. It's like your body's battery is constantly drained, making even simple tasks feel overwhelming. Imagine struggling to get out of bed, feeling winded after a short walk, or finding it hard to concentrate on your favorite TV show. That's what this fatigue can feel like. For seniors, this kind of chronic fatigue can have a huge impact on daily life. It might mean skipping social activities, neglecting household chores, or even struggling with personal care. The worst part? Many older adults brush off this extreme tiredness as just another part of aging, potentially missing a crucial warning sign. The gastroenterologist that we mentioned previously, Dr. Richards, warns that any fatigue lasting longer than 2 weeks should raise concerns, especially if it's accompanied by other symptoms like unexplained weight loss or changes in bowel habits. He emphasizes that early reporting of persistent fatigue can lead to faster diagnosis and better outcomes if colon cancer is the underlying cause. Here's something that might surprise you. Fatigue in colon cancer patients isn't just about feeling tired. It's often linked to other symptoms we've discussed, like unexplained weight loss. As your body fights against cancer cells, it uses up more energy, leaving you feeling drained. Plus, if you're experiencing blood loss due to the cancer, you might develop anemia, which can make fatigue even worse. The key takeaway? Don't ignore persistent fatigue. If you've been feeling unusually tired for more than 2 weeks, especially if you're experiencing other symptoms we've mentioned, it's time to talk to your doctor. Remember, addressing fatigue early could lead to early detection of underlying issues, potentially saving your life. Now that we've uncovered the hidden dangers of fatigue, let's move on to another symptom that many seniors hesitate to discuss. But ignoring it could have serious consequences. It's a common discomfort that could be more than just indigestion. Red flag number 4, the abdominal discomfort puzzle. We've all experienced stomach aches, but did you know there's a specific type of abdominal pain that has doctors on high alert? It's a sensation that many seniors dismiss, yet understanding it could be the key to catching colon cancer in its early stages. As we age, occasional stomach discomfort becomes more common. You might experience bloating after a big meal, cramps from eating something that didn't agree with you, or general digestive upset. These are usually harmless and pass quickly. But when it comes to colon cancer, the pain is different, and it's crucial to know how to spot it. Colon cancer pain often feels more persistent and intense than typical digestive issues. It might start as a dull ache that gradually worsens over time. You could experience cramping in your lower abdomen that doesn't seem to go away even after using the bathroom. Some people describe it as a feeling of fullness or pressure that's hard to ignore. There are specific types of abdominal discomfort associated with colon problems. One is called tenesmus, a constant urge to have a bowel movement, even when your bowels are empty. This can be incredibly uncomfortable and may lead to straining. Another sign is pain that mimics gas or bloating, but doesn't improve with passing gas or changing your diet. Tracking your pain patterns can be a powerful tool in identifying potential issues. Keep a log of when the pain occurs, how long it lasts, and what, if anything, seems to trigger or relieve it. This information can be invaluable to your doctor in determining whether your discomfort might be linked to colon cancer or another serious condition. Understanding and addressing abdominal discomfort early can make a world of difference. Many people with colon cancer don't experience symptoms initially, but when they do appear, paying attention to them can lead to earlier detection and better outcomes. Remember, your body is constantly communicating with you. It's up to you to listen and act on what it's saying. As we wrap up our discussion on abdominal discomfort, there's one more critical symptom we need to address. It's a topic that many find uncomfortable to talk about, but ignoring it could have serious consequences. Are you prepared to confront a symptom that could save your life? Red flag number 5, the blood and stool taboo. Did you know that over 70% of colon cancer patients report blood in their stool as an early warning sign? Yet many people, especially seniors, are too embarrassed to discuss this crucial symptom with their doctors. It's time to overcome our discomfort and confront this taboo topic head on. Your life may depend on it. Let's talk about what's happening in your toilet bowl. It might not be the most pleasant conversation, but it could be the most important one you have today. Blood in your stool isn't just an inconvenience. It's a potential red flag that shouldn't be ignored. Now, you might be wondering what exactly to look for. Blood can appear in different ways in your stool. Sometimes it's bright red, easily visible on toilet paper or in the bowl. Other times, it might make your stool look dark or tarry. In some cases, the blood isn't even visible to the naked eye, but it's still there, slowly causing problems. Here's something that might surprise you. In many cases, the first sign of colorectal cancer can be a blood test showing a low red blood cell count. This happens because of chronic blood loss from the cancer, even when you can't see it. It's a sneaky way the disease can progress without you realizing it. Dr. Richards has some advice we should all take to heart. He says that any symptoms like bloody stools or abdominal pain that stick around for more than 2 weeks should prompt an immediate visit to your doctor. Don't wait and see if it goes away. Take action. You might be thinking, but it's so embarrassing to talk about this. I get it, it's not a comfortable topic. But here's the thing, your doctor has heard it all before. They're not there to judge you, they're there to help you. And the few moments of discomfort you might feel talking about it are nothing compared to the peace of mind you'll get from knowing what's really going on. Remember, early detection can make all the difference. Patients who report symptoms like blood in their stool early on tend to have better outcomes. They catch the problem sooner, which means treatment can start earlier. And when it comes to colon cancer, earlier treatment often means better chances of success. So the next time you're in the bathroom, pay attention. If you notice anything unusual, don't brush it off. It could be your body trying to tell you something important. Are you ready to listen? We've covered 5 critical symptoms that seniors should never ignore. From changes in your bathroom habits to unexplained weight loss, persistent fatigue, abdominal discomfort, and blood in your stool, these are all potential warning signs of colon cancer. Do you know anyone who has experienced these symptoms? Please share your story in the comments. If you've experienced any of these symptoms for more than 2 weeks, it's time to schedule a checkup with your doctor. Remember, early detection can make a world of difference. The American Cancer Society reports that when colon cancer is caught early, the survival rates are dramatically higher. In fact, 80% to 95% of people diagnosed at stage 1 survive at least 5 years, compared to only about 15% for those diagnosed at stage 4. Don't let embarrassment or fear stop you from taking care of your health. Your body is talking to you, and it's time to listen. By staying vigilant and acting promptly on these symptoms, you're taking a powerful step towards protecting your health and potentially saving your own life. Thanks for watching and subscribing to our channel. And remember, the best of your healthy golden years are ahead of you. See you in the next video.